I've worked at the same company in Nashville for 18 years and lived here in Columbia, and at the beginning of March I was let go from that job. And at first my wife and I kind of freaked out because we didn't know what to do. The COBRA to keep my very good insurance from my employer was over $1,500 a month. And when you're unemployed and looking for a job, that's a lot of money.
I'm a nurse, and as of a few years ago, I was working with a population of patients who are uninsured and underinsured in a federally funded clinic. In our office, we were really talented at finding ways of getting health care for people who didn't have insurance. We had a sample cabinet to get the medications. We knew which pharmacies sold the cheapest drugs. You know, we could work with our local hospital to get them their testing at a better rate than if they went elsewhere. But to be able to have them have access to health insurance so that they didn't have to worry about knowing tricks of the trade was a huge relief for them, and it was a huge relief for us.
When I was 16 years old, I was diagnosed with fatty liver disease. It was basically fat deposits on my liver that really the only way to get rid of them were through treatment and exercise treatment that I couldn't afford. My mother, she had health insurance at the time, but the health insurance really didn't cover what I needed it to cover. We were pretty much paying out of pocket for all the treatments that went with the whole diagnosing, treating, and even then, I mean, the treatments were pretty scarce because we couldn't afford it at that time. Before the AHCA, our health insurance saw it as a pre-existing health condition, something that they won't cover. They made the prices skyrocket like crazy. So it was pretty difficult for our family to even try to make ends meet at that point.
But I contacted a friend who had helped other people get insurance via the federal exchange and the AHCA, and she told us where to go. And in about 10 days, we were able to get our insurance coverage through the AHCA. And with the tax credit, because I was unemployed, we paid virtually nothing. And so to have insurance when you're unemployed, between jobs, is just a godsend. And I can't imagine what people did before.
Once the Affordable Care Act was passed and they were able to finally get health insurance, it was a huge burden off of them, and it was a huge burden off of us, that we were finally able to provide them with care without having to worry about all the extra energy that we had to spend in order to keep their costs down. I worry about my patients now. They're not even my patients anymore. I left that office a few years ago when I moved, but I worry about them with the American Health Care Act. How many of them are going to lose their health care again? How many of them are going to have to go back to jumping through hoops? They all have pre-existing conditions. 23 to 24 million people are going to be kicked off of health insurance by 2024. Even if that's not you, it's somebody that you know. It's somebody that you care about. It's the elderly, it's children, it's pregnant women. It's going to affect everybody. Nobody can escape this.
When the Affordable Care Act was passed, I was able to obtain insurance through the marketplace, something that the government had then just started an offering. If the Affordable Care Act had not passed, honestly, I don't think I would be here speaking to you. It was extremely difficult. No person at 16 years old or at all should have to go through something so difficult. It's like a death sentence. Without insurance, I wouldn't have been here.
I do work in mental health, however, and I think my biggest concern with the latest draft is that they're providing the state the ability to waive whether or not they want to cover behavioral health or addiction. This will not lower costs for anyone. The costs will shift. This population, one of our most vulnerable populations, is not going to go away because we choose not to provide them coverage or care. What's going to happen is you're going to have suicides increase, you're going to have drug use increase, you're going to have crime increase, incarceration is going to increase, and healthcare costs are ultimately going to increase because people are going to be utilizing the ERs in their local communities. This is especially harmful for rural areas because these ERs cannot absorb the cost. These costs will be passed on to everyone who comes into those hospitals, and it could possibly cause these hospitals to fold, and so people in rural areas won't even have access to health care when they're needed.
The newest version of Trump Care is devastating for not only Tennesseans, but all United States citizens. Opioid crisis in Tennessee is going to get worse. When we have a record amount of people ODing in the emergency room, we're going to be kicking them off the roster and making problems worse for Tennesseans. An age tax will be placed on the elderly. Prenatal care will be gutted. This is a bad plan, secretly crafted in the back rooms of Congress. Senate Majority Leader McConnell wants to have the bill passed as soon as possible. It was crafted in secret, and now they're trying to jam it down the throats of Americans without Americans having the proper time to view it. The best way to combat this is to call your senators, Senator Corker and Senator Alexander.
Reach out to your senators, your state representatives, your congressmen, everybody. Even send Donald Trump, a message saying, hey, this is why we need the Affordable Care Act. This is why it is so important to keep what is in place in place.
Call your representative, call your senator, call Lamar Alexander, call Bob Corker. If you're not in Tennessee, call your representative. We have to stop this. We have to.